they are pursuing their passions in Ayurveda, but really to make a positive change in their communities. Whether it's as healers or teachers, mothers, non-profit, running non-profits or running businesses. So it's there's really a forum for us to hear their stories and what brought them on that path, and learn from them, get inspired by them. But also the second reason that I started this is because this is a way for us to also connect with one another as a community. We are all in different places, and don't often get to see each other, and often are also not necessarily surrounded by other people in the Ayurveda space. So this is an opportunity for us to connect with other like-minded people, and I hope that some of these connections and friendships will grow and will create a very vibrant Ayurveda professional community. So with that, I'm a quick intro to Moira. She is currently studying her AWP from Kerala Ayurveda. And she's actually been someone who's, personally experienced fistula as a patient and really struggled with it. And that's really what brought her to the path of Ayurveda. And having, gone through treatment, she's actually now helping people all over the world, patients all over the world, to find treatment in India and guide them in their journey. So with that, I'm going to hand over to you, Moira. Thank you so much for being here.
Thank you so much for having me. Thanks to everyone who has signed in for this. I really appreciate it. This is a passion project of mine, as Shruti said, that came about because of a personal experience that I'd had. And I can't say that I'm a very good public speaker, but my interest in sharing this information with you is stronger than my anxiety about presenting it. So I really just appreciate that you're taking the time. My goal with this presentation is to share a little bit about my experience, to maybe give more of a personal connection for all of you to fistulas, rectal fistula, anal fistula, rectovaginal fistulas. It's a condition that a lot of people who suffer with don't talk about. It's embarrassing for them. It's can cause a lot of depression and a lot of feelings of despair. And it taps in, I think because of the nature of it being in the pelvic cavity, it taps into some very deep-rooted feelings of shame, insecurity. It just kind of hits us at a really deep place. And so this particular population, I feel like, needs a special kind of support. And I believe that through Ayurveda, we can offer the very best kinds of support through a cure, but also through what we can do as wellness counselors, as practitioners outside of India. And so I'm hoping to share some information with you about that. Here, Ayurvedic treatment inside India is the only place where the Kshar Sutra surgery can take place legally. And this is one of the oldest surgeries that Sushruta wrote about, and it has a very high success rate compared to any of the treatments that are available in the US or the rest of the world. Because of this, and because the treatment is only available in India, it's my desire to really have a support system of Ayurvedic professionals outside India that can support this population both mentally and physically, either while they're suffering or struggling with the fistula, helping them to seek treatment, and then also in the recovery period, helping them to adjust to life fistula-free or to help manage the other symptoms that come with it. So I'm hoping to give you a little bit of an understanding of this condition and what Ayurvedic professionals can do. I'll start with my personal story. I had very difficult childbirth with my two youngest children. And after those deliveries, I had started to develop tailbone pain that was very severe, hip pain that was very severe, I was in a regular yoga practice, a daily yoga practice, for many years, and started to notice losing balance on the right side of my body. And just sort of a deep pain there that I thought was muscular. So I tried to work through it. And then as the years went on, the pain really increased. And as you see here in 2015, the pain hit a point where I could no longer even walk without some really severe shocks of pain running through the right side of my body. And I was exhausted, absolutely exhausted, with severe anemia that didn't seem to respond to diet or supplementation. I felt sick, but I didn't know what was wrong. In the summer of 2016, I had been on a number of road trips and driving here and there with my children, and the pain became so debilitating that I just couldn't even really move any longer. And I noticed a swelling on my right buttock. And at first we thought it was muscular. We had doctors look at it. It looked like it was maybe just like a muscle spasm. And as the weeks went on, that muscle spasm grew to a very large lump that was hot. And at that point, I went to the emergency room, where it was discovered that underneath my gluteals, I had a grapefruit-sized infection that had been taking up pretty much that whole cavity, and I needed to be rushed in for emergency surgery because there's a risk of sepsis. That's called an abscess, an anal abscess. They don't really know if a fistula causes an abscess or if an abscess causes a fistula. There's a lot of debate about that. What we do know is that 50% of all patients who go into the emergency room with an anal abscess do end up with fistulas. Now, and all the fistula sufferers that I've spoken with over the years, not one of them were told when they were in the emergency room or in their follow-up visits or when they went in for their abscess surgery that a fistula could be a result. It was a shock to everyone when it was discovered. And I find that to be the first troubling thing about this condition is the lack of education out there for people and for the sufferers. So I had this emergency surgery and was in the hospital for 5 days. They gave a very, they cut into my buttock. It was a 4-inch deep wound and a 4-inch wide. And it needed to be packed every day, multiple times a day with feet and feet of cotton stuffing to allow it to heal correctly. I had that open wound until January it didn't close up. The doctors couldn't explain to me why the wound wasn't closing. I was in severe pain. I was relying on narcotic medicines to even just do basic everyday care. I had to have a sedentary lifestyle because of the pain, and also for having the whole right buttock on my body so swollen and draining, and there was so much packing in there that it kind of inhibits any kind of movement in the rest of your body. It's a very depressing and difficult thing to face. Just the process of packing a wound of that size is very confronting, and it can kind of make a person feel extremely vulnerable. And that's a lot of what you'll hear if you talk to other fistula patients, is that amount of shame and vulnerability that comes with this recovery of these surgeries. In January, I went and talked to my doctor about the wound that was not healing. And that's when he decided to tell me that it could be a fistula. And so he did an exam and looked for it. And then I had a surgical exam. So an exam under anesthesia where they mapped the fistula, discovered it. And they place in the fistula, I'll get into this a little bit later, but they place a ring And the ring is to keep that fistula tract open so that it prevents further infections in the ring. Now, this kind of surgical thing, we were hoping that the fistula was very superficial and that the doctor would fix it really quick. And that was what we were told was the possibility that when it came out of the surgery, I was told that the fistula is so complex that it would be almost impossible to treat surgically without guaranteed incontinence, fecal incontinence. So doctors went through a list of the different surgical options that are available, and they were all very they're really scary to hear the options and then know that they're very little success. I became very depressed and full of despair, which led me to research an Ayurvedic method called Kshar Sutra, which I learned about when I decided to look up statistics around the world of rates of incontinence for people who had suffered from fistula and undergone surgeries. And I was hoping that somewhere my chances of being incontinent would be lessened. And that's when I came upon an article or a research study published by the World Health Organization that showed the rates of incontinence throughout the world. And throughout the world, we see 8 out of 12 patients incontinent, 9 out of 13 incontinent, 18 out of 23 incontinent. And then I came to India and it said 0 out of 297, 0 out of 68. And I've been looking at this, check, what are they doing in India that they're not doing anywhere else in the world? And that got me to look into this. And that's when I noticed that they were referring to a surgery that they call it, and we know as Kshar Sutra. I began to have a little bit of hope when I read about that and started to research Ayurvedic doctors inside India. Now, first, I contacted Ayurvedic practitioners, Ayurvedic doctors. Yes?
Sorry to interrupt you. We are having some audio issues.
So, okay.
So there were some bits maybe in the last 2 or 3 minutes that we may not have heard very well. So
okay.
If you may want to repeat a little bit.
Yeah, I'll back up.
Yeah.
Okay, thank you. So I'm not sure if you heard that I had learned about I discovered Kshar Sutra, that the rates of incontinence with this treatment were practically nil, which led me to start looking for doctors or just have this treatment in India. At the time, I did not know anyone who had this treatment before, and I did not know who to go to or who to contact. So I get a hold of Mama. I contacted various doctors, Ayurvedic practitioners here in the US and also in Europe. And I kind of was hitting a dead end because to get a referral for a doctor in India proved to be very difficult. I guess people didn't want to make a referral that they weren't sure of, and I didn't really know who to ask. At the time, I had joined a fistula support group for other fistula sufferers and had come into contact with other people who were willing to explore other options as well. And that's when I came in contact with people who had undergone Kshar Sutra. And then I began emailing dozens and dozens of doctors in India, sending them my MRI reports, and starting a conversation. By the time spring was over, I had selected a doctor, I bought my tickets for India, and I was prepared to go. So I went to Bangalore, India, and had my first surgery there. And immediately I felt relief. The pain that I had been in for all this time was immediately lessened because the pain of healing where the pain of the fistula and the other surgeries, the pain of feeling very sick. And the very big difference.
Hey, Moira. I think the audio issue is coming up again.
I'm seeing that. Hold
on. Is there, do you know if it may be to do with, you know, your internet? We're not sure. But from time to time, the sound gets garbled. So that's sort of happening a couple of times. You're on mute right now. Yep. Yep. Oh, sorry, you're muted again.
It's not letting me.
I mean, yeah.
Can you hear me now?
Yeah, we can hear you now. Maybe one thing you can try is switching off your video and just maybe speaking.
Okay, let me try that. Yep. Okay. Just let me know if it's.
Yeah,
can you
maybe monitor the chat window a little bit, because I think people will post when the audio is.
Okay, I'm sorry.
No worries.
Hold on a second. I'm not sure how to find the chat window when I am sharing my screen. So.
Oh, okay. So no worries. If it happens, I'll.
Yeah, I found it. Okay. I'm sorry, everyone. I'll get there.
This is great. Thank you for doing this.
Yeah, gladly. Okay. Okay, all right, I see that now. All right, thanks, everyone. Okay, so I went to India in September and had my first treatment. And while I was there, I had contact with a couple people from the Fistula Forum at home who had said to me that if my surgery were going well, they would come out to meet me and they would start their treatment there as well. And so by the time it was November and I was a couple months into my treatment, I had about 6 people from the forum there with me. And we were all there kind of as a support system with each other. And I also came in contact with other fistula sufferers who had gone to other doctors in India for Kshar Sutra. And we were kind of chatting a lot and spending time just supporting one another through the process. In December, I was declared fistula-free by the doctor. And in January, I was home, I was healthy. And that's when a few of us decided to start a forum on Facebook, specifically for people who were hoping to learn about Kshar Sutra and who we just wanted to provide a resource for those people. So, I'm going to give a little brief. I know some of us have already learned a lot about fistulas and what they are, but here's an image that can maybe show you a little better. There's many different kinds of fistulas. These are the most traditional. As you can see, what happens is the body makes a tunnel. There's some kind of injury, whether it's an infection or a hard fall off of they slip on ice and they bruise their bum, and it creates a little bit of an abrasion in the tissues. It creates an inflammation, and the body's way of correcting that inflammation is to heal it the same way it tries to heal a bone or it tries to heal a skin knee. But unfortunately, what it does is it forms a tunnel of epithelial tissue. And it creates a communication between, in this case, the rectum and the external part of the body, the buttock, or in some cases, the rectum and the vaginal wall, or the anus and the external, the buttock. And sometimes these tracts, these look very simple in that they're just single tracts, but oftentimes the track will take off in many different directions, as mine did, and loop around. Now, as you can see here, in a superficial fistula, the fistula is not traveling through the sphincter muscle. Those are very easy to fix. You can go in and the doctor will just excise the wall of that fistula and collapse it. And it'll heal up, and those people do great. They don't have any reoccurrence, and they can move on with their life. And most of the time when you talk to someone about fistula, they're telling you about a superficial fistula, because that's where the hope is. But all these other fistulas, as you can see, they're traveling through the sphincter muscles. And the problem with that is that when there is, if you were to go, the sphincter muscles are like rubber bands. And if you were to put a small snip into a rubber band, the whole rubber band will snap. And that would create incontinence. And this is why treating a complex fistula of any nature, any kind of complexity, becomes very, very dangerous for the patient. So, except in cases of sepsis, a fistula diagnosis is rarely life-threatening. Except in cases of a superficial fistula, a fistula diagnosis is a life sentence to misery. And this is because it's very, very difficult to treat. And one of the things that makes it most emotionally difficult for a fistula patient is that they're usually being seen by a colorectal surgeon. And colorectal surgeons spend most of their time dealing with people who have life-threatening cancer diagnosis. They are breaking the news they're to these patients, and there's a lot of support for those people that you're not going to get if you come into a colorectal surgeon with a fistula, because it is not life-threatening in most cases. However, because it is such an incredibly painful condition, and because it leads to so much depression and there's so much shame in that part of the body, and because there's very, very little hope with the modern surgery options that are available, these people are really suffering. And the medical providers don't really address that as much. It seems more simple to them than it actually is. These are some quotes that I have from the Fistula Forum that I was a part of. These are the people who have not chosen to use Kshar Sutra. Either they cannot afford to go to India, or they don't trust another, they're not feeling very trustful of these kinds of alternative treatments, I guess, as they would refer to it. But this shows some of the despair that these people are going through. As you can see here, the one quote, "I'm not in any position to go to work. I've been dealing this for 10 years now and had multiple failed surgeries in the last 18 months alone. I've had 11 operations that have not helped at all. Now I'm awaiting a date for a colostomy to see if things will get better. Things will get a better chance of healing. It's a terrible thing to deal with, and people don't realize how painful it is and exhausting it can be." Another quote, "Went to my 8-week post-op fistula failure checkup yesterday. I'm so beside myself. I hate the stupid ileostomy that they have me saying it would increase the surgery success rate. It failed in 4 days. Turns out they messed it up again. I've been in agonizing pain the last couple of weeks, and yet again, the setons are too tight and embedded into my skin. I give up. More surgery tomorrow. Round 5, here we go. My lift failed. I'm devastated. Why does it take so many tries to heal this? Now I need to have another surgery, and all I want is my normal life back. The external wound is really hurting now, too, especially after a bowel movement. Bleeding a lot more and still discharged, too. So now I am worried I'm re-abscessing. Going to call the nurse today and ask if it's normal. So over this." And then the last quote, "This fistula has taken the life out of me. I'm not sure how to live with it anymore." A desire to commit suicide is one symptom that a lot of people with fistulas go through because there's no hope on the horizon. There's a chance of a cure in allopathic medicine. And this fistula group, these are the kinds of things that I see every day over and over again. And in the Kshar Sutra Facebook group that we started, the kinds of posts that we have there are very, very different because they're posts of hope and of cures, which I'll show you a little bit later. In allopathic medicine, we have some surgical options for a complex fistula and nano, and here's that might be good for you to know. In a fistulotomy, the incontinence rate is up to 40%. With a ceton, the incontinence rate is 7%. With fibrin glue, which is where they go in and they have a glue that has fibers in it to try to close that tract, it's a 69% overall fistula recurrence. With the lift procedure, a failure rate of 60%. With the advanced and flap, a procedure failure rate of 23% and a guaranteed 50% incontinence. Bioprosthetic plug, a 57% success rate. And then if none of these things work, usually the doctors will go down and they'll try all of these things. And as the failures increase and increase, the body develops so much scar tissue from those attempted surgeries that the whole rectal wall and anal wall begins to deteriorate. And oftentimes that deterioration will even go into the vaginal wall. In the case of men, it'll even extend out into their penis. At that point, the doctor is either given ileostomy or a colostomy to hope to divert the stool out of the fistula tract to give some chance of healing. Some of the clinical causes of fistula, which as we're studying Ayurveda, you'll see some of these things listed. The Ayurvedic doctors that I've spoken with who do Kshar Sutra all agree that the primary cause is mostly Manda Agni. I was told by my doctor in India that it was my habit of eating a lot of raw vegetables, especially before bedtime, that had just killed my acne, and then my body couldn't process. It just brought my whole immune system down and caused a lot of these other problems. The second most common cause is Crohn's disease, and this is particularly the most important piece for Ayurvedic practitioners to hold on to, I think, from this presentation is this population of Crohn's disease, because that's where I think we can do the most good. Someone who's been through radiation therapy, people who have had infected anal glands, an anorectal abscess, chlamydia, diabetes, or different kinds of cancer. Something else that has come up as I've talked to hundreds of different fistula patients is that in my case, 100% of all fistula patients that I've talked to have reported one of these four main life events in the years where their symptoms were first developing. The death of a child or a significant other. They were caregiving to a special needs child or to an ailing parent. They had a history of being in a physically or emotionally abusive romantic relationship, or they had had traumatic childbirth or a major accident that caused an injury to their rectal area or their pelvic floor. Here I have a quote from PubMed, a PubMed study that came out that said, of the fistula patients, 83% reported one or more stressful events in the year prior to diagnosis. Our results suggest that an altered emotional state plays an important role in the pathogenesis of anal fistula and underline the importance of psychological screening in patients with anorectal disorders. This also goes along with the Ayurvedic principles and what we know about fistulas and how big of a role stress and the mind plays in developing so many different illnesses. Now we're going to get the Kshar Sutra because this is where the hope lies in this condition. Kshar means shaitan or destruction. It's an alkaline medicine that destroys unhealthy or impure tissue. Kshara is an extract of the ashes of different Ayurvedic herbs in powder, liquid, or paste form. In Sanskrit, sutra means sacred thread or threads. Kshar Sutra therapy is practiced in India with the high success rate of 96% for life. Here I've got a little drawing that shows the thread, as you can see in the purple and gold, what they do is they take this thread, this sacred thread, and they coat it with 21 layers of caustic medicines, and they thread it through the fistula tract and back out and knot it. And what happens is the medicine will be absorbed into that fistula tract, and then immediately it cauterizes it and it stimulates healing. That will open up that tract. And then a week later or 2 weeks later, the doctor will go back and he'll take that old thread out and lay a brand new thread in and tighten it a tiny, tiny bit. And then that tract will again absorb these caustic, it'll cauterize that tract. Slowly and slowly, the tract will become smaller and smaller and more superficial to the body. And what that's allowing it to do is to move through the muscle so slow and with so much respect for that muscular tissue. The muscle heals. Where that fistula is replaced with very supple scar tissue that becomes flexible and that can behave and work along with, in coordination with the sphincter muscle itself, preserving continence. Here are just some clips I want to show you. I've worked to protect everyone's identity. But this is the joy in our Kshar Sutra for Fistula Forum. You can see how many people are full of hope, because every day, a couple times a week, we see these people saying, I'm fistula free. This worked. And these are all people who were feeling such despair, and then they joined our forum. They learned about Kshar Sutra. They found encouragement, travel tips, referrals to doctors, help getting their visa, and emotional support. The three of us who run the forum are available 24 hours a day for free to counsel any of these people. And now so many people have gone to India and come back here that now they do that for each other. And it's just kind of taken on a life of its own. And it's actually just a very beautiful forum to just sit and look at, because there's so much hope in it, and to see these people's lives just completely renewed by this amazing ancient treatment. So I want to talk about Crohn's for a minute, because 23 to 38%, oh, there's a chat, hold on. 38, thank you. 23 to 38% of all Crohn's patients will develop fistulas. This is particularly important for us because according to Ayurvedic principles, doing Kshar Sutra on a person whose mucosal tract is inflamed is not in their best interest. And so there are a huge amount of people who suffer with fistulas, miserably with fistulas, sometimes 5, 6, 7, 8 fistulas at the same time, who discover Kshar Sutra, and then they learn that they are not good candidates for this because their tracts are so inflamed that the tissue won't grow back. When the Kshar goes through the fistula tract, the scar that's formed in its place will not be healthy scar tissue. And because of the inflamed nature of that whole area, they're going to spend 4, 5, 6 months in India getting treated, and then a couple months later, a new fistula will pop up in another area. More ulcers will pop up. And so, according to Sushruta, first we have to address the inflammation in the fistula tract. This is very difficult for people because it can take a year or two, and it needs Ayurvedic medicines, Ayurvedic lifestyle support. And so my hope is that Ayurvedic professionals outside India will become educated about Crohn's in a way that should there be a patient who has a fistula and also has Crohn's, we can help them to get into remission here so that they have the hope of then going to India for treatment and really having the problem resolved. The most depressing thing is when you spend, for me, if I've spent hours and many, many conversations with a person who is at the, who really is ready to end their life because of this condition, and then they discover that they have Crohn's disease. The lack of knowledge about how to treat this, people who know how to it's a lot to ask someone to move to India for 4 to 6 months to afford that trip, to leave their families. It's a pretty big ask. There's hope that comes with it. But to then tell them that they also have to go to India to get treatment for Crohn's first, it becomes impossible. And especially for people who live in countries that can't get visas to India. In the case of, there are countries where people really cannot travel to India. And then there are also countries where the economy is so poor that they couldn't even afford the visa to travel to India for treatment, even if they could get there by other means. Now, there are hospitals, Ayurvedic hospitals in India that will treat fistula patients for free. There are also private doctors who offer more of a Western comfort experience, who cost a little bit more. I would say my first surgery here in the U.S. cost $80,000 cash. My second surgery here cost $30,000. And when I went to India and had this treatment, my doctor saw me every single day for 4 months. He treated me. The nurses were available 24 hours a day. And the total cost came to less than $5,000 for treatment. There's another special concerns that I want everyone to hear to understand as far as someone who has had major surgeries or fistula treatment, is that scar tissue is not the same kind of tissue as the tissue that was replaced. So there will be discomfort with scars, and especially if you're working with someone with yoga, or if you are helping a fistula patient who would, even if they're cured, they will have a lot of scar tissue around their anus. And in the case of something simple, even prescribing Triphala, if the irritation from any bowel movement, if it gets a little bit hot, or it's a little runny, or it's a little hard, they're going to feel a lot of pressure and pain and irritation in their scar tissue. Women, especially around their menses, they'll have that inflammation in the area, and their scar tissue will act up. And so it's something it's a kindness to already know that when you're talking with a patient, to already kind of be thinking about the scars they might, or to ask about the scar tissue that they have, because it's kind of a difficult thing to bring up. And then this last point that I want to, things I want to cover are, how can we in the Ayurvedic community outside India help this population of people? Most importantly is to address the mind. These people some of them, one of my closest friends that I met in India, and he is the one that runs the forum with me, he had 26 surgeries in the US in 3 years. And 5 months in India, now he's cured. But during those 26 surgeries, he developed tremendous anxiety. And he is still dealing with that. So he's had 2 years cured, like me, and he's still dealing with this really persistent anxiety that developed as a result of these failed surgeries, one after the other. A lot of people have had their marital partners leave them. You can, in some cases, people can still continue sexual relations if you have a very loving and a very committed partner, but the fecal matter that comes out of the wound and the dressings and the bleeding and the open wounds that a lot of these people have can be very difficult for marriage partners, and a lot of them end up getting divorced or they have their spouses leave them. And so there's a lot of grief with this condition and depression. There's also post-traumatic stress disorder that I would say the majority of fistula patients are having some post-traumatic stress disorder symptoms. And the other thing that doesn't often get talked about is narcotic dependence. If you've been in pain for 1 year, 2 years, 3 years, and the only way to manage your life, to still go to work and to still cook dinner for your family, was to take a narcotic, Some of these people are still struggling with a desire to have that drug. And so that's something to be mindful of if you do come into contact with someone who's had these conditions. Ayurvedic professionals can offer dietary, lifestyle, and topical comfort measures. The skin of someone who has an open wound is very sensitive. The bowel movements are very painful. Learning to move in their body when half of their body is inflamed or is cut open is something that we need coaching on, and these people need help with these things. Another thing is that this is a very hard thing to discuss, and some people, especially men, have only told their mothers. I've spoken with a lot of men who suffer with this condition, and some of them actually have fecal matter coming out of their penis on all day long. Their incontinence is coming through their penis, and that's very, very difficult for populations of people who have never talked about those kinds of things. And most men have only told their mother. A couple of men will tell maybe their significant other. And there's so much shame in this. And so helping these patients to talk to family members or helping to educate the family members is a huge service we can provide. And as I addressed earlier, to study Crohn's and work with yogis, helping them to reach remission so that they have the option to go to India and receive Kshar Sutra would be the highest work that someone could do in this, really, because there's such a lack of help with these Crohn's patients. To learn the common formulation prescribed post Kshar Sutra, many people, when they leave India, the doctor gives them local formulations that they like using, and they get home and they don't know where to purchase these things or what these medicines did or whether or not they should continue them. So this is a great service we can provide this community, is to help to understand the medicines, what they're used for, and help them to find replacements for them. As I addressed earlier, to understand the sensitive nature of surgical scar tissue near the anus. Another one is help the yogi reconnect with their body after years of pain-avoidant postures. And what I mean by this is there's a little saying or a name that fistula sufferers call themselves. We call each other side leaners. Because if one buttock is in horrendous pain, you're going to put all the pressure and lean onto the other buttock. That's how we kind of get it wrong in life. That's how we drive the car. That's how we sit in chairs. And that sitting with that posture for a long time, as you can imagine, creates all kinds of muscular imbalances that take a long time to correct. And so someone who is doing yoga therapy or simple pranayama to help them to reintegrate into their body and to learn how to use their body again after years of being ill. Many of them had sedentary recovery from multiple surgeries. You figure someone's had 26 surgeries in 3 years. That person has not been able to exercise. And they will have a lot of muscular discomfort, a lot of shame about their body, and a lot of pain. And so that's something we can help them with as well. And then lastly, if you come across these patients, please refer them to support groups, to my support group, the Kshar Sutra for Fistula's Facebook forum, and then also blog posts about that. Encourage them to find sources of hope. And lastly, please contact me for backup. This is something that I do out of passion and love, and I'm available 24 hours a day if someone who is suffering with this condition needs any kind of emotional or practical support. And I'm finishing this with some photos of people who are cured. And these are some of the people from my forum. Some of them are with their doctor. But it's just, I find it beautiful to look at the looks on these people's faces. And I can promise you, every single one of these people were depressed, were in despair, and thought their lives were over. And whenever I'm having a bad day, I look at these beautiful faces and find it so encouraging. And then here is a link to a blog that the actual Fistula Forum is only open to people who are suffering with fistulas or people who are in direct support and supporting someone with fistula. It's closed to any medical professionals. But if you want to learn more, you can go to this blog, the Healed by Kshar Sutra blog. And so now I'm happy to take any questions. Try to open up my blogs. You're saying, if there's time, can you briefly go over Crohn's disease? So in the case of, oh, thank you, Anu. Crohn's disease is where there's an inflammatory condition in the mucosal lining of the digestive tract. And basically what that means is the person has an autoimmune condition that is creating ulcers over and over and over, these ulcerations. And it's as you can imagine, it's extremely painful. And sometimes these ulcers do turn into fistulas. And in that case, we call it fistulizing Crohn's, where the person gets ulcers and then the ulcers heal themselves by making these fistulas. And in this case, I'll give an example of one woman who began treatment as she was diagnosed with a fistula at the same time as me. We were in regular correspondence, and she was going the allopathic route for Crohn's treatment and also for fistula surgeries. She was newly married and young woman, maybe her early 20s, maybe 24, 25. And we had stayed in contact, but she chose to continue following her doctor's advice in the UK, continued to get surgical treatment. When I came back from India, healed, and I was in contact with her, I found out that all of her surgeries had created so much damage in her that her actual vaginal wall was shredded. The tissue had so much scar tissue that it could not even hold together. She could no longer be intimate with her husband. She had her a part of her colon removed, and her life is basically destroyed. And this is because they just don't know how to heal these diseases. They do not know. They're trying their best. I'm not insulting these professionals, like colorectal surgeons who handle these diseases. They are trying their best, but they do not have an Ayurvedic understanding of physiology and of pathology. And there's something in this, what we're lucky to know, that makes all the difference between a lifetime of misery and a cure. I'm going to do a research paper on Crohn's and fistulas, which will have a lot more of the clinical data and a lot more information. So if anyone is interested in reading that when I'm completed, I'm happy to send it to anybody for more of a scientific view of this, since I can't really cover everything here. And if you would like any links, please contact me and I can give any kind of resources about Crohn's or fistulas or anything anyone could benefit from. Okay, so I'll start with aceton and then I'll answer the question about where I was in India. Aceton is typically a thread or like a zip tie, kind of, that they lay in the fistula tract. And all it does is holds that fistula open, because in some cases the fistula will close externally. It'll be a little pinhole. And if you look at photos, oftentimes it'll just look like a little dimple. But when that closes, that fistula is draining material, fecal matter, from the rectum into a closed tunnel, and that's creating abscess. And that's also what creates the potential for sepsis. It's also what encourages the body to make new tracts traveling all other places. So aceton basically keeps that tract open and allows the fecal matter to drain out of that external opening in the skin. Usually they put aceton in a person who to prepare them for surgery or to help them to manage their fistula if they are not good candidates for surgery. In the case of, there are two kinds of setons in allopathic medicine. One is just a simple suseton. The other is called a cutting seton. And a cutting seton is designed to slowly cut. Basically, it's like an internal saw that they implant into the sphincter muscle. And those patients are actually expected to pull on the string every day and to slowly saw through their own sphincter muscle. The rate of incontinence with this is extremely high. It's very barbaric. And a lot of people confuse it with the Kshar Sutra thread, because Kshar Sutra is also a thread that's wrapped through the fistula. However, because of the medicines that are inlaid into this thread, the Kshar Sutra thread moves through the fistula with chemical cauterization. It's a chemical process. There's a little bit of tension on the thread to help guide the thread to the exterior of the body, but it's not cutting through the fistula with mechanical pressure, whereas a cutting seton is using purely mechanical pressure. And so the difference in the body, as you can see, with Kshar Sutra, there's zero chance of incontinence, and with a cutting seton, it's extremely high. I chose a doctor named Dr. Ramesh Bhatt, who actually he treated the worst case of fistula on medical record, and I can give anybody a link to his paper on that. But this gentleman that he treated actually had a fistula that was branching all the way down through his hip, down his leg, and into his feet. He had 6 open wounds on his feet, which doctors had treated, believing that it was cancer. And in desperation, he was suicidal. He came to Dr. Ramesh Bhatt in Bangalore, India. And Dr. Bhatt diagnosed it as a fistula and treated it with Kshar Sutra. It's a very interesting report that there's also a recording on YouTube of him doing a little talk about it, which I can link you to if you're interested. The herbs, besides Kshar Sutra, there are no herbs that can heal a fistula, because the fistula itself is an epithelial tract. The body recognizes it as healed. It's similar to if you were to break your leg, the body would immediately begin healing that break. It would just heal it in whatever position the break was in. It takes a skilled doctor or a clinician to set the bone so that the healing is beneficial to the body. If you don't set the bone properly, even though the body will heal the bone, you will still end up crippled. And so it's similar with a fistula. The body had an injury. The body healed the injury with an epithelial lining in a tunnel. The body recognizes that it's healed. The body no longer considers that as a problem, but it creates nightmares for the people who have it. So any kind of herbs would be designed to help drainage, help keep the digestive system healthy. In the case of a very, very superficial fistula that's very, very tiny, it can dry up the fistula. It can create a drying action so that there is no drainage coming through. So there are things herbs that can be used to manage the fistula, but the only way to actually remove a fistula is through surgical methods, and ideally Kshar Sutra. The herbs that my doctor had us on were herbs to help with digestion, so of course like AAA, and then different formulations to help keep infection low, to address the mind, to keep the stress level low. And these are local formulations that he designed himself. But I can also I'm happy to share with anybody who's interested bottles of you can see pictures and see what formulations he's using. And of course it would depend on the constitution and the health of the person.
Thank you, Moira. This was amazing. Thank you so much. Very, very informative and excellent presentation. So well put together. And I'm sure that everybody here really appreciates the work you put in to share this with us today. Thank you so much. Are there any other comments or questions before we wrap up? I think everyone's pretty stunned.
Thank you. Thank you. Yes, it's
just amazing.
It's a story of hope for sure. Yeah.
Awesome.
Yes. Thank you for giving me the opportunity to do this. And I really appreciate everyone taking the time out of your day to listen to me. And definitely contact me for any additional information. I would love to share. This is my passion.
Awesome. Thank you so much. And thank you to several of the people who actually, this is the first time they're coming in for a talk today. I do see a lot of new faces, new names here. So welcome to everybody to the Ayurveda community, and hope to see you guys again soon. Just quick announcement as we wrap up, the next talk for Women in Ayurveda is going to be scheduled in March. Since Anu, you're here, I hope it's okay for me to actually share. Anu is going to be doing the next talk. If you if you're interested, I will be sending over an email with the registration links, etc., in a couple of weeks. So stay tuned, and thank you again for tuning in today.
Looking forward to that. Thank you so much.
Thank you. Thank you so much. Have a good Friday, everyone.
You as well.
Bye.
Bye.